Donc maintenant, on passe au dernier panel avant les meetings, un panel de fournisseurs de services et de solutions. Donc j'aimerais appeler sur scène avec moi Naomi Gold-Apple de Alaya Care, André Simard, Gray Oncologie et Jack de Ivadolab, Jack. On va faire ce panel aussi bilingue, si ça vous va. Je vais poser mes questions en français, mais vous me répondez en anglais. Donc, si on commence d'abord par un tour de table, pour que chacun vous nous expliquiez quelle est votre organisation et les spécificités de ce que vous offrez comme solution ou service. Commencez par Naomi.
Okay, happy to be here. Can you hear me? Yeah, okay. So Alaya Care, we actually focus on what happens once you leave the hospital, which is the whole industry of home care. So we make software for the home care industry, so really like an ERP for home care, everything from intake to scheduling to service delivery to the financial side of it. And there's many different ways that we can leverage AI along that journey. And this is, I'm actually on my fourth or third scale project right now. And Matt doesn't know, but I'm about to submit him a third or a fifth one very shortly. And there's many different ways, especially in the situation that we're at right now. The panel before just talked about staffing. And there's a huge shortage of labor in the home care industry, from home health aides to nurses to therapists. So being efficient and being able to optimize resources is of the utmost importance right now, to be able to optimize the use of these precious resources right now.
Merci, André.
Yes, my name is Andre Diamond. I'm the CEO and co-founder of Gray Oncology Solutions, and really kind of born in part as the pandemic was starting, and then scale was a huge part, along with the SHIM, who was the first hospital to partner with us. And really we're razor focused on oncology, logistics specifically, at least for now, and ensuring that the patient trajectory through their cancer care, regardless of what intervention it has, is not as fragmented as it typically is, and that we can ensure that the way that we're optimizing a trajectory is from start to finish, the way that a patient sees it, and then inside each of those individual silos, whether it's radiation or chemo or imaging, all of the resources are being used as effectively as possible. Certainly a recurring theme.
Thank you. Jack?
So we're Evado Labs. Evado Labs is focused on building completely customized solutions. So thank you for all the wonderful introductions on the projects with the SHIM, with Kathy, David with MUHC, and Srini with Princess Margaret. We are the ones that come in and help you build something that isn't built yet. So we kind of accelerate the entire process for you. We don't sell you products, we build them with you. So that's what Evado Labs does.
Donc, ma deuxième question s'adresse à toi, Noémie. On sait que votre solution est peu utilisée au Québec. Donc, on aimerait comprendre pourquoi, selon vous, et donner des exemples d'applications que vous faites ailleurs au Canada, puis qui fonctionnent vraiment bien, là, dans le fond, vos success stories.
First of all is that Alaya Care, so we're a company that is actually born in Montreal, right here, and we are, the industry uses our solutions all over Canada, a lot in the United States, and almost all of Australia. But we are not being used here in Quebec. So her question was about why. But we have very positive beginnings, and right now we are doing a pilot with actually the CIUS Nord de l'Île. So we're very excited about that, and even we're going to start some interesting optimization of their nurses, of the planning of their routes. So there has been a bit more red tape. There's a lot of some bureaucracy, some let's say, public tender processes that sometimes can be challenging. But we're managed to penetrating in because there's definitely a need. And in the other parts of Canada, we have, we work with some of the actual health authorities to run it on behalf of the government. And we have a lot of private companies that use our software as well, sometimes to deliver on behalf of the government as well. So we are very much looking forward to this pilot that has started just this week, and we're hoping because we live here and we know that we're all aging, and so we want these solutions to be ready for when we're going to need it as well.
And do you want to describe us like one specific success story you've had outside of Quebec? Like one project you can talk about?
In Canada or?
Yeah.
Yeah, sure. I have one of our business development people here today who could speak about it. But we've launched in, let's say, PEI. So the whole province of PEI uses our solution to be able to do all of the referrals, to be able to do all of the intake, to be able to plan all of the care that's needed for both personal care and nursing for the entire province. And this is a big success, and we're hoping to replicate it in all the provinces.
Great, thank you, Naomi. André, Grey Oncology a déjà fait un projet avec Scale AI aussi. Est-ce que tu peux nous en parler du projet-là, dans le fond, des défis que vous avez rencontrés, mais aussi les résultats, ou aussi et surtout les résultats que vous commencez à voir?
Yeah, so as I think we heard with the last panel, there's certainly a whole lot of challenges and difficulties in this field. So I echo everything everyone else said. I'll try to add color that hasn't been added yet. I think one of the big learnings, both from our side as an industry and working with the hospital, is AI is one tool in the toolbox. If it's a drill and you're trying to build a house, there's a whole lot more that you need for that. And those range from technical skills, user interface skills, user experience skills, human skills, just working with change management. So I think we really needed to start to kind of learn that in the process and then leverage those skills to really make sure that the deployment, which admittedly was a very tight time frame, was successful. So fortunately, and to credit all parties involved, we were able to go live. It's hard to say exactly when because there was so much co-development involved, but I would say at least for a year by now. And there's a number of impacts that we see, both sort of hard impacts and soft impacts. The primary ones I can highlight in terms of administrative burden, both due to the optimization and automation, we're seeing somewhere between 50 and 80% reduced time required to actually do these tasks in terms of managing those logistics. And then in terms of efficiency gains and just increasing access to care, this was particularly during COVID, and now we're trying to kind of translate that to understand how it has an impact in today's environment, but unlocking somewhere between 11 and 12 hours of capacity a day without actually having to scale the resources up. So really being able to just do more with less and make sure that all patients are being treated as quickly as possible.
Great, thank you. Jack, Ivadolab a à son actif plusieurs projets, tu en as parlé tout à l'heure dans le milieu de la santé. Qu'est-ce qui fait, selon toi, qu'un projet fonctionne? Quels sont les défis que vous avez rencontrés, mais comment on peut s'assurer d'avoir des résultats concluants à la fin? Dans le fond, parce que chacun d'entre vous ici qui représentez les hôpitaux, vous allez avoir à vendre ces investissements-là à vos conseils d'administration, à vos équipes d'exécutifs. Donc, qu'est-ce qui fait qu'un projet fonctionne et comment on peut le vendre?
Excellente question. What I'll say is, when you think about AI, you might be thinking about drug discovery, precision medicine, things that are complex, but don't. Think about things that are annoying, things that could be done better, things where you see lack of efficiency. This is exactly the type of project that you should be focusing on first. Because you're going to get faster buy-in from the stakeholders at the hospital. As mentioned by Kathy and the rest of the panel, it's complex. There's legacy processes, legacy systems, there's personal biases, opinions. All those things need to be reduced as much as possible when you're choosing that project. Because the science typically is not that complex. Like what we're doing with different industry, and the hospital is not that much different. The stakes are higher. Without a doubt, there's lives at stake. But the science is not going to be complex. What will be complex is the integration. So find opportunities where you think that integration will be easier. As mentioned also by Kathy earlier, make it simple. People don't want another complex system, another complex interface to deal with that they're going to have to spend a lot of hours training on. No, make it simple, make it tangible, and then build up the complexity as you go along the way. So keep that in mind when you're thinking about opportunities that you want to present. And we're here to listen along with the rest of the panel, everyone else that is here. We're excited to hear them.
Great, thank you. So my last question, ou en terminant, ma dernière question, j'aimerais beaucoup vous entendre sur l'avenir de l'IA dans le domaine de la santé. Qu'est-ce qui, selon vous, s'en vient et qu'est-ce qu'on devrait suivre de près pour être au jour des dernières tendances? Noémie, est-ce que tu veux commencer?
Oui, absolument. So in the future, what is coming? So in our industry, definitely there's a huge move from the governments to move to something called value-based pay as opposed to just transactional pay. So this means that if a home care worker shows up, does whatever they have to do and leaves, everybody gets paid no matter what. But the governments are not interested in that anymore because everybody really wants to be concretely measuring patient outcomes. And as well, companies want to be measuring employee outcomes. We want employees, caregivers, nurses, we want them to be happy and satisfied in their positions so that they stay. So we want to make sure that outcomes are maximized. And in order to do this, then you have to measure. The home care industry traditionally is a little bit less sophisticated and does not measure as much. So now these measurements are being imposed. And if the measurements are being imposed, it means that we have the opportunity to actually move the needle on these measurements. And AI definitely helps to be able to mitigate risk. So we have been able to, and we are concentrating on, with the rest of the industry, on predicting which patients, home care patients, are at risk of being rehospitalized, who's at risk of falling, who's at risk of having some adverse events, and how can we mitigate it. So where AI is really playing a role is being able to ingest all of the data that is happening all the time. In home care, every visit has tons of data that is being collected, so there's a narrative about this particular patient over time, and the AI is able to pinpoint when risk is at its height and when the caregivers can be actually mitigating. So the results so far are really astounding, and we can see this really helping to improve outcomes in the near future. On the other side, on the flow, as one of the doctors was saying on stage, the flow and in the optimization, this is huge as well to gain efficiencies. Right? So right now we have a lot of inefficient processes. There's schedulers who try to keep everything in their heads. They try to use Google Maps to efficiently make the routes for the nurses and the caregivers, and a human cannot keep all of that in their heads. So by introducing these algorithms, it's not only shortening the time, but it's also improving the schedules for the caregivers, who we want them to be happy and satisfied and have full days, so that they keep in their roles, and that they'll be there in the future to care for more patients.
Great insight. Thank you, Naomi. Yeah, that's so amazing.
So I'll give a three-part answer, sort of a short-term, mid-term, long-term. In the short term, because we're looking at patient trajectories and just the inherent stochastic nature of healthcare, there's tons of prediction, both in terms of predictive analytics and prescriptive analytics, that we're looking at doing, and this is kind of what we're beginning to develop now, of how can we ensure that we're understanding what that patient flow coming through the hospital doors is, and then how can we actually act on that? Rather than just telling you we think it's this, how can we then convert that directly into what that means for how many staff you need, or whether you can approve this vacation or that vacation, so on and so forth. In the midterm, we're looking at actually working on solving this whole deployment and integration challenge and how long that takes by, is there a way that we can take our solution and make it generalizable and use AI to learn what the actual environment is, and from that have it kind of calibrate itself. And of course there's still human elements to that, but how can we shorten the process of deployment fundamentally? And then in the very long term, looking at clinical outcomes, where everything always kind of circles back to. And because we're predicting these trajectories and understanding these trajectories through a health system, how can we then layer in outcomes and begin to have a really deep understanding of which sort of trajectories for which sort of patients are actually impactful, and then begin to use AI to help inform what trajectory a patient could go on.
Great. Jack?
So healthcare, for me, and I think for everyone in the room, is probably the most important thing if you think about it, right? You can have more money, you can have more friends, whatever, but health is if you either have it or you don't. So everyone here is going to be impacted, or you were impacted in the past, and that should be something that triggers their thinking process about the future. So the future is, I'm not going to say bleak, but we have to do more with the same resources. We have an aging population, we have more and more different healthcare issues that we're becoming more aware of, that we have to treat, and all these elements are going to be expensive to tackle. So AI is one of the few ways that we know right now that enables us to do more with the same amount of resources. So to me, the future of healthcare is making sure that we act now, because we don't want to act on this too late. You don't want to be in a bed somewhere and being told, well, actually, we will not be able to schedule you today for your surgery, or we won't be able to do the radiation fraction today because something went wrong. Like, you don't want to hear that moment. So the tools that we're developing are creating the foundation. The hospitals that we're talking in the previous panels are really the pioneers in this. There's not too many hospitals in Canada that we are aware of that are truly acting on this and have, for instance, 100 AI projects in mind. Maybe all 100 of them will not be implemented, but it's a question of acting on it, learning through the experience, and making sure that as you build up your capacity in this, in 5 or 10 years, you're not going to be behind. You're not going to be lagging, right? Because at that point, maybe your life will be at risk in those moments. So that's what we think. I'm very pragmatic about this. I'm not going to say, well, we're going to do precision medicine and you're going to have the perfect pathway for the patient for the entire healthcare system. Especially when we're visiting other countries, Western countries, everyone knows aging population is number one. Like the perfect example was in Denmark when they told us that the entire basically cohort of students at university would need to go into medicine in order to sustain the current system that they have. That makes absolutely no sense, and it's not feasible. So the only way is prevention, which is better detection, which is prediction, which is one of the key elements that AI can bring, and optimization for us is making the right recommendation about what should happen to that patient for him to not end up at a more critical state. So I'll leave it at that, and I hope that inspires you to think about some use cases when we talk.
Merci.